Hey everyone, and welcome to This Explainer. Today, we're diving into some incredibly profound source material that looks at the true nature of chaplaincy and the art of spiritual presence. Now, I know what you might be thinking. When you hear the word chaplain, you probably immediately think of traditional religion, right? Maybe dogma or someone coming into a hospital room just to pray with you. But as we're going to see today, true spiritual care isn't about religious imposition at all. It's actually about the mastery of existential listening. It's about creating a safe space where people can find their own meaning during their absolute darkest moments. We're going to explore how chaplains use patient metaphors, a fascinating concept called the three-word test, and the idea of becoming like still water. So let's jump right in, and actually, I want to start with a question that might catch you a little off guard. So, what holds your life together? Just take a second and really let the existential weight of that sink in. And then ask yourself this one. What do you fear losing? Notice how these questions just completely bypass the small talk. They cut straight to the core of who we actually are. What gives your life meaning? You see, these are the real spiritual questions that chaplains are deeply trained to ask. And, interestingly enough, a surprisingly high percentage of secular or atheist patients actively request chaplains precisely to have this exact kind of existential space. It turns out you really don't need religious language to talk about meaning, joy, or love. Which brings us to Section 1, Beyond Traditional Religious Language, asking the questions that matter to everyone. The truth is, a patient's demographic background never actually dictates their spiritual needs. I mean, you can't just look at someone's chart and assume you know their faith. Someone listed as Christian might be deeply devout, sure, but they could also be merely cultural or wounded by past experiences, or maybe they're even an atheist now. So a chaplain's job is to figure out where a person actually is by asking these existential questions. What would you fight for? What brings you joy? Who do you love? How do you find meaning when things totally fall apart? These questions matter to everyone, right? They build an empathy bridge. Because the job here isn't to convert anybody or defend a specific faith. It is purely to accompany people through a crisis, honoring whatever brings them joy and meaning, and doing it entirely in their own language. Section 2, the three-word test, a universal approach to offering blessings. So what exactly happens when a chaplain wants to offer comfort, but they have absolutely no idea what a patient's specific beliefs are? Well, they use a highly effective, completely non-denominational tool. Think about the contrast between a traditional, specific blessing, like "May God bless you," or even something like "May the universe guide you," versus a more universal approach, "May you find peace, strength, and healing." So why do those three specific words work like absolute magic? Because qualities like peace, strength, and healing resonate beautifully across the board, whether you're talking to someone from a specific religion, someone who's spiritual but not religious, or a strict atheist. Ultimately, peace and healing matter to every single one of us. It's all about serving the patient's needs, not the comfort level of the person speaking. Section 3, Listening for Patient Metaphors, Speaking the Patient's Language. Moving a bit deeper into how we process really difficult experiences, our sources highlight something crucial. When everyday words just completely fail us in moments of deep distress, abstract clinical language is the last thing that helps. But metaphors? Metaphors bypass the intellect and speak directly to the heart. For example, say a patient tells you, "I feel like I'm drowning in all these medical decisions." If you respond with, "Well, let's think about this logically," you're just dragging them into this cold, abstract, and honestly invalidating space. Instead, a trained chaplain folds right into their world. They might say, "Tell me more about being underwater. What would help you surface?" And it doesn't matter if the patient uses a metaphor about drowning, playing golf, engineering, or gardening. The whole goal is to amplify their metaphor and explore it, meeting them fully in their own imaginative world. Now, to actually build this skill, the sources outline a really practical exercise called metaphor journaling. It literally just starts with noticing the metaphors patients use in everyday conversation. You write them down afterward, explore what they might reveal, and then practice using them yourself. Let's say a patient mentions, "I just feel like I'm in a fog lately." An insightful caregiver is going to note that this probably means the patient feels disoriented, isolated, maybe unable to see the path ahead. So during the next visit, they might naturally bring it up, asking, "You mentioned the fog earlier. What's happening right now that makes it so hard to see clearly?" It's just such a powerful way to validate someone's hidden feelings without forcing them to use clinical terms. Section 4, Reframing through Human Story, Finding Agency in the Narrative. Psychological research talks a lot about cognitive reframing as this incredibly powerful way to help people view their stress differently, shifting their perception from a negative to a positive. And chaplains facilitate this, but not by lecturing or giving advice. They do it simply by deeply, deeply witnessing a complex story. Imagine someone's starting narrative is, I'm a total failure. My marriage ended, I'm completely alone. Just through this sheer process of telling that full story to someone who is actively, compassionately listening, the patient can externalize the pain and eventually reframe their own identity into something like, I survived a really difficult relationship and I learned a lot about myself. The absolute most crucial point here, the chaplain does not dictate this reframe. No way. The patient discovers their own resilience purely by having their full story reflected back to them with compassion. Okay, now we arrive at what I think is a truly paradigm-shifting communication concept from the text. It's called the question as a statement. Basically, the idea is that just because someone asks you a question, you really don't have to answer it. In fact, almost every existential question asked in a moment of deep pain is actually a statement of suffering. It is not a request for factual information. Let's look at a heavy example. Imagine a patient in absolute agony asking, why did God let this happen? Now, a terrible response would be to jump into explaining theology or theodicy. Trying to answer that surface question with cold logic feels incredibly dismissive, right? Because what that question actually translates to is, I'm devastated and I am really struggling to make sense of this. A much better, far more human response addresses the actual need. Tell me about your pain. What feels most unfair to you right now? The goal is just to hear them in their anger and their devastation. You're addressing the deep human need beneath the surface words.
Section 5. The Mirror of Still Water. The ultimate metaphor for spiritual care.
As we draw toward the conclusion of this explainer, we reach the absolute deepest, most poetic part of this journey inward. This is the place where words frankly just fall away entirely. The text shares this beautiful insight about a chaplain who had survived her own absolutely devastating personal losses. And when she sits with a grieving family, she doesn't use words to say, hey, I understand. She doesn't need to. Instead, she simply embodies the truth that people can survive profound loss and eventually find meaning again. Her very presence is the story, and that story entirely wordlessly gives patients hope. Sometimes the most powerful teaching and the deepest comforting is done without uttering a single word. There's one chaplain in our source material who summarized his entire approach to this work using an incredible quote from the poet W.B. Yeats. It goes, "Make our minds so like still water that beings gather about us that they may see their own images." Just let that sit with you for a moment. This is literally the ultimate metaphor for chaplaincy. The goal is to become like still water, calm, highly receptive, and crystal clear. You become a mirror for the other person. You're not a teacher, you're certainly not a fixer, and you're not an authority figure. You just create this perfectly still space so that people can finally see themselves and their own situations more clearly. And in doing so, they find their own understanding. Which brings us to our final thought for this explainer. What is the still water you need to find in your own life today? Where in your life do you need that peace, that deep, judgment-free listening, or that universal blessing of strength and healing? And perhaps even more importantly, who can you be that still water for? Think about that as you go through the rest of your day. Thank you so much for joining me for this journey into the art of spiritual presence.